What'd you do? Put it on. Hi, everyone. We will start in just a few minutes.
Hi, this is Molly.
Hi, Molly. We're going to start in just 1 minute.
Cool, thanks.
Okay, good afternoon.
Good afternoon.
Welcome to our April 2016 Learning Collaborative call. Who's surprised it's April? I know I am. I'm going to start by going over our agenda briefly, taking some attendance, and going over some work-related policy change, and then in the end, providing some project updates. So just looking here who has joined us today. So this is Jordana, and in this with me is Sarah Ann, Letitia is in the room with me, and Sierra. So thank you to the Health Alliance colleagues for joining us. And if you've just joined the call and there's some background noise coming from your end, please feel free to mute yourself. As we take the mute off. So, who do I have from the Hope Clinic on today? Okay, Hope will come.
This is Gabby from Rice, San Diego.
Gabby from Rice, great. How about from Roosevelt?
This is Mizan. That's here. Hello.
Anyone from San Fernando?
Yeah, Aurora.
Hello, Aurora.
Hi.
Anyone from Merlo Station? Okay, we'll circle back around. How about anyone from Washington Middle School? Andy, I think I saw you on there. Can you say hello? Okay, Mandy, I see you're on here. Anyone on from Milwaukee?
This is Rachel.
Rachel.
Hi there.
And Century?
This is Brittany.
Brittany. Okay, how about Lake Forest?
This is Kathleen.
Okay. And Turner?
This is Sarah.
Okay. Whiteford?
Chelsea.
Hi, Tosi.
Hey.
Northwood? Okay, circle back. And Pat, are you on or still? Pat is going to be joining us later. Okay, so great showing today, and we'll come back to the folks who I missed earlier and hopefully are able to join in a minute or two. Nicole, I saw you're on from Maryland.
Hey.
Molly, I heard your name. Lori, are you on? Okay. And Georgia? Okay, circle back. All right, moving forward. Give me 1 second. I need to make sure I enable my slideshow to. Okay. So I thought this would be a good opportunity at 3 o'clock in the afternoon here on the East Coast and noon time on the West Coast to watch a little video that is going to get us a little bit active and thinking about some school-wide policy changes around physical activity.
Hello there, I'm the Pufferson. Did you know baby giraffes sometimes move? Anyway, I'm here to tell you all about Go Noodle, made up of tons and tons of games and videos that kids can use throughout the day. You know how some mornings it's hard to get your kids out of bed? Go Noodle has a gazillion ways to get them up and moving. One of them is maximum. Slowly bend the top half of your body one side. Guess what? Alligator's teeth are hollow. Anyway, sometimes it's just too long. It's wiggly and squirmy. Well, Go Noodle stops the squirmy with active stuff. What's up, gang? How's your heart? Get set. Dance along with Tutu Kangaroo as I tell you more about Go Noodle. Go, Noodle! Get your body, moving. Go Noodle helps kids stay focused and motivated. Moving throughout the day releases endorphins, gets the blood flowing, and improves kids' mood and brain power. Did you pay attention to all that? Good, because we're going down to test. Just kidding, but if your child is stressed out over now. Okay, I'm sure you have tons of stuff you need to do, so I'll be quick. GoNoodle has games and videos that get kids dancing, coordinating, positive thinking, and paintball drawing. That's GoNoodle. Guess what? It's almost impossible to lick your own elbow. Doesn't mean I can't try. Gotta go. See you around, GoNoodle.
Okay, so what would a school-wide policy on physical activity look like that could utilize GoNoodle? You guys can unmute yourselves and just kind of chime in.
Well, this is Sarah. We had done a school-wide policy where prior to the bell, the first AM bell, every teacher utilized GoNoodle and then tracked the utilization by teachers.
Awesome. So every single day, each classroom teacher was responsible for turning on the GoNoodle and then reporting how many minutes of GoNoodle were used?
No, the GoNoodle program, like GoNoodle itself is free, but I guess with like at some cost, it will actually give you a printout of utilization, and our hospital system had actually paid for that portion of it. So, the teachers didn't have to do anything other than turn it on, and they could. A lot of them utilize the student to help with that in the morning.
Great. Has anyone else used GoNoodle in a similar type of fashion? Has anyone else heard of GoNoodle?
This is Brittany from Century. Yeah, I've heard of GoNoodle before. We just haven't used it before.
Okay, great. So Sarah, maybe you could share what kind of impact have you seen in your classrooms or in your school as a result of utilizing GoNoodle? Do the kids seem to enjoy it? Are they bringing it home to their families? Are teachers indicating that behavior is better?
Yeah, so GoNoodle is an awesome program, and it is free. I think it's probably best suited towards elementary school on the feedback I've got on our district wellness, that the middle school and up maybe doesn't quite feel it works as well for them, but I mean, but it could depending on your middle school setting. Yeah, I mean, we were able to get major increase in activity time by utilizing it, and the kids love it. We've also done nights where we do GoNoodle and the parents come out and do it with their kids, and they talk, oh, this is what my kid talks about. So I mean, the kids talk about it, they like it. Definitely that has been our goal as far as having the brain breaks, and the teachers do notice improved focus when utilizing the brain breaks, and it's they have all kinds of, so there's ones that are active, there's some yoga and things like that, so kind of they can gear it towards sort of what they need at that time. Also, oh, I had one other, I don't know, am I missing something in the
Oh, that was great.
Okay.
That's great. But I really love how you talked about how every classroom in the school is utilizing it and at a certain time. So if someone was to write up, if you're thinking about a school-wide physical activity policy, that's a program that you're already utilizing, but it's being utilized in a certain way, in a kind of procedural manner. So that would be a school-wide policy on physical activity. Does anyone else have anything similar that they could share that they've done that is either like a program like GoNoodle or a beginning of the day stretching that's kind of mandated throughout the school or at the end of the school day? Okay, well, we'll get you thinking about that a little bit more as we move through. Thank you so much for watching that video. I know it was only half of the screen there. but I'm glad you were able to hear. So as we are thinking and talking about policy change, you'll remember from the action plan template, we ask kind of what you're doing at the clinic level, at the school level, and at the systems level. This is the last half. Depicted here, you see the last half of the action plan. So this is the third tab of the plan, where we recognize that you've already moved through your needs assessment approval. You've gathered a lot of environmental information. You've gathered a lot of information about what's happening in and around the school, as well as what's worked well in the past for your site. So congratulations on kind of wrapping up that piece, and I know that some sites are in the final stages of that work. But as we move forward, we're moving into the more action-oriented components. And we're really excited to use this call to frame all of the great work that you've been doing and to continue to support you in telling your story and how we can lift up your story and report back on all of the great work that you've done to Kaiser and to other potential funders in the future. So in looking at this action plan and this piece particularly, we know that you're doing things at all levels. So you're doing things that are clinical, you're doing things that are individually based, conducting groups, small group anxiety groups, small health education and nutrition groups, and classroom-based education as well. We also know you're doing other things outside of the clinic walls in the school. And some of these are iterative, so they build on each other, and some of them are a little bit different strategies and approaches that you might have in the school versus at the clinic. We're just trying to help you move through the steps and consider how to get to the bottom tier that we list at the bottom of the action plan, the systems approaches. And our job is really to synthesize and assess what you're doing at all of these different levels, and as I mentioned, to tell the story the best you can. So we're just trying to hone that section and move toward being able to evaluate in terms of policy change. And we're going to ask you to do some kind of critical thinking and looking back at those plans that you've been filling out, or for those sites that are just beginning to fill them out, take a look at the whole picture and the whole story. So with that being said, last time we spoke as a whole group, Kara Ann did a wonderful presentation on this policy development framework and the different components which make up policy development. We're really here to build your capacity in seeing yourselves as agents of change within your schools. And that's because that's already work that you're doing. So Kara Ann, I'm going to turn it over to Kara Ann, our evaluator for the School-Based Health Alliance. And she's just going to do a quick pulse check on where you are in this process.
Good afternoon. Thank you, everyone. It is cherry blossom season, and you will hear that in my voice. So pardon my raspiness and my allergies, so bear with me. As Jordana said, this is a little pulse check. She's checked in. She shared a wonderful presentation last week with the rest of the School-Based Health Alliance on all of the excellent work that everyone's been doing. We've looked at the action plans. I know everyone's gone back and revised those. And now it's time to take it to the next level. How many folks on the phone, we can either do a quick chat or we can just do a quick check-in, remember the policy framework that we spoke about and have had a chance to think about how your action plans and how the work that you're doing fits into these 9 boxes? And I want to open up that question with a, if I haven't thought about that, that's an okay answer as well, because that's part of what this call is today, is to go ahead and say, I haven't had a chance to think about it. We're going to think about it together. But if you have had a chance to think about it, that'd be great too. So how many folks have had a chance to look at this policy framework and think about what you're doing through the lens of these 9 boxes, or these 9 triangles? Has anyone started to do that yet, or has it quite gotten there yet?
This is Tara with Century, and I'm going to say no. We just got our data last week, or actually it's Monday, the spreadsheet.
Great. Okay, good. Thank you. But I like the fact that you're thinking about it in the terms of when you get your data, that's going to help drive that. Perfect. Anyone else have had a chance to look at what they're doing through this lens?
Well,
Mandy?
this is Sarah. Jordana sent out a little worksheet that helped me start thinking about it.
Great.
So, and with the refresh our memory with the what all of those, what is governance and things like that. So.
Absolutely. That's a tough question, isn't it? When we start thinking about what we're doing on an everyday basis and implementing programs or trying to make a change, and we have something like governance come up, it's a really tough question, isn't it?
It is.
Great. Anyone else have any thoughts on that?
This is Rachel in Milwaukee, and I am a part of the sort of district-wide wellness committee, and we're trying to get a district-wide wellness policy for the whole school district, and so in doing that and in applying for other separate grants, we've had to go through some of these things talked about in the framework, starting to think about policy development. What would a wellness policy look like? Stakeholder management, trying to figure out how to engage anybody from the administrations of the different schools to the school board, to the superintendent. So we've done a little bit of kind of all of those things, I would say.
Great. And boy, isn't that fun.
Yeah.
Absolutely. That's actually where the rubber meets the road, and that's where you start to eliminate some really surprising challenges, but that's also where the excitement of the work happens for a lot of people. I mean, there's always excitement in your work, but this can actually take it to another level. So that's my first question for everyone, and I want to give you the opportunity not to answer right away. I know many people are listening to this call in groups or maybe with 1 or 2 folks. So I'd like to take about 3 or 4 minutes after I ask the question for you to mute your phones, talk within yourself, or talk within your groups that are listening to this. And my first question is to just ask everyone, how are you feeling about moving forward, thinking about these 9 triangles and taking those action plans and going beyond the action plans? How are you feeling about that? Not what you're doing, but how are you feeling about that? And take a few minutes to really assess that and chime in when you're ready.
This is Aurora from San Fernando High School.
Yes, Aurora.
Yeah, we haven't quite been able to use the actual framework. We just got our data this morning. So we'll be looking into that, but I feel like the framework makes it a lot, in a sense, it makes it a lot less overwhelming because you're able to kind of separate the different components and set different goals for the different components of getting them done. So it creates kind of like a step basis rather than this whole big chunk of change, if that quite makes sense.
Yes, it does. Absolutely.
Yeah, so in that sense, I mean, I am planning on using the framework triangle, and I feel like it's a really good tool and to kind of like separate the different components of what is essential to kind of make our program happening.
Great. We're going to come back to that. I like that.
And that's a really good point, too, is that, when we talk about policy, it sounds so huge and so out of maybe a health educator's comfort zone, but breaking it down into these small different pieces, which many of which you're already thinking about and including in your thought process, but haven't necessarily thought about it as risk management or contract procurement, that this gives you a little bit of a toolkit of how to do it.
Anyone else want to share how they're feeling?
This is Gabby from Rice, San Diego.
Yes.
Can anyone hear me?
Absolutely, yes, we can hear you, Gabby.
Okay, great. I just want to say that I'm looking at this triangle with the different components and stuff, and I'm trying to put the information that Renee, of course, left before she left in her pregnancy leave. So I just want to say that I'm looking and trying to find what some of the policies and things that she had got started. So I just want to be honest and just say that that's where I'm at, and I really would love the help, and I'm looking forward to talking to Jordana on the 29th. So I apologize, but that's the truth. I'm trying to put everything together that she left behind, you know, for her information and surveys that she's done. So I want to totally be honest with that. So.
No, I appreciate that. I appreciate that. And I'm going to share a personal story about applying this framework the first time I did it, when I've heard from a few other people and kind of, again, get a pulse on where we all are on just our feelings about how we're approaching this, where we are in the process. Anyone else have any different feelings? If not, I'll move forward. Okay, so the first time I had to apply this policy framework to work I was doing, I was absolutely terrified and overwhelmed. I had no idea how to do it. So I really liked your comment about the fact that breaking it down into manageable pieces is a little bit easier, being able to look at something and say, oh, this isn't a gigantic process that I can't do. I can break it down into manageable pieces. I'd like to reiterate that those manageable pieces are not linear. These things happen iteratively. They happen in parallel. I'd also like to point out that not all of them happen to the same extent. Some may not get addressed at all. Ideally, we want to address everything. But it's difficult to address everything, especially when to your point before, sometimes these definitions are really difficult. What is governance? What does that mean, and how do we engage with that? So I'm really glad you're bringing up these questions and letting us know honestly where you are, because that's going to help us to provide the technical assistance you need so that we can move forward with these action plans, so that we can work towards together as a team the policy changes that you're already doing, that you're on your way to doing, but being able to, at the end of the day, say, as Jordana said, here's my story. It ended with this policy change, and that gives you, as well as the School-Based Health Alliance, the ability to share nationally all of the great work that you're doing. You're going to become the change agents for other schools, for other districts, because you're our pilot site. So that's why I'm really excited about this work, and that's why I'm really excited about your work and excited about helping you work through this process to get to what we call policy change. So the next question, with that said, is how do you see yourself moving towards this triangle or through this triangle from this point? And I've already heard someone say we're going to collect data and we're going to go back and we're going to look at this. I also heard someone say we're engaging stakeholders, but we're starting to engage stakeholders. Another person on the call said, we're looking at governance, but I'm not quite sure what that means. So again, I'd like you to take a few minutes and think, what is it that I need to start to move forward to help fill out that tool that Jordana put together that will help you get through this triangle and on the other side of it? I'm going to give you all a few more minutes, and then we'll come back to maybe some specifics that we talked about if you're not ready to share out, or we might go back to the noodle example and work through that together, whatever feels more comfortable. But I'll give you a couple of minutes to see if anybody wants to jump in and start. What we're trying to focus on is, what do you need? What do you feel like your next steps are to work through this triangle so that we can get to the end of your story, which is the policy change?
Hi, this is Kathleen from Lake Forest.
Hi, Kathleen. Thank you for being the first one to speak up.
Okay, here at Lake Forest, we have a collaborative team that meets monthly. And this collaborative team consists of the School and Health Center team, Fulton County, which is the Cook County Student Service representative. We have the foster nurse. We also have data collection people from Fulton County, and we also have the school principal. We're all a part of this team. And moving forward, what I would do is this frame presented to the team and see how best we could put them together to bring up the policy change. So I think this is something that at our next meeting, which is next week, will be presented to the team, and we'll work from there, trying to do our best and implement different changes to be able to policy change.
Great. So what is it that you plan to present? Do you plan to present the final product, what you're asking for, this is the policy change we want to implement, or are you going to be at the level of engaging the stakeholders and getting their advice as to what the policy needs to look like? Where are you in that process?
Engaging the stakeholders, letting them see what the policy needs to look like, yes. So at this point, engaging them. And then also at the same time, just letting them know the things that already started.
Great. So have you thought through any of the other parts of this triangle as perhaps part of your agenda for that meeting?
Well, I actually just started looking at this triangle this week. So as of maybe tomorrow or Monday, I'll be able to see which part I'd like to address.
Okay.
And I think, Kathleen, I think a lot of your RAPS data, as Tara and Aurora said, will start to shape some of what this will look like and what policies you are sort of aiming to work towards. So it would be great to have that initial, stakeholder conversation about, what the anticipated outcomes are as well, where you see the direction going. But it will be, much richer once you have the data to be able to say, our population has X, Y, and Z needs, and let's put our priority efforts in developing a policy to work on specifically hunger, or to work on specifically, whatnot. So it's a really strong, that Lake-Brown triangle, the stakeholder management triangle, is a really strong one to have from the get-go in shaping and forming what your policies are going to look like. So that's a really great idea.
But I think we had the conversation already, and so we're waiting on the data from the lab to be able to move forward. So we're already having two people in place who will address some issues and address some concerns that will present itself from that data.
Excellent. Are there other people on the call that, I'm sure there are, I mean, everyone's somewhere in the process. Anyone else on the call in the stakeholder, I heard someone else talk about this, anyone else in the call, in the stakeholder engagement process where you're utilizing your stakeholders to help develop policy?
Rachel, perhaps you.
Yeah, I was just going to say that, I mean, we, in terms of like feedback, that I would say is one way in which we've used or we've engaged with stakeholders, and anything from sort of a survey, and then just directly communicating with the board for the district, and then the administration of each school. So I'm personally engaging with the administration at Milwaukee High School, while other people on the committee are personally engaging with the sort of admin at other high schools in the district, just to sort of get like a sort of comprehensive understanding of what is it they want to see in their building in terms of a wellness policy, or some of the things that they hear. Because we did a district-wide survey at the beginning of the year, but again, you know, a district-wide survey is pretty macro, and then hearing those like needs from individual leaders in each school, I think is a little bit different. So in terms of like management, the board has been really great in terms of, you know, supporting us trying to get the grant for the school district. So there hasn't been a ton there. I think yesterday, actually, I did a presentation. The superintendent of our district was at our school yesterday morning for an all-staff meeting to present about something related to a bond measure, but he was there, and I took the opportunity to do something around staff wellness and stress reduction at that meeting right after him. You know, for one, to sort of plant the seed, and to also like have him be, you know, I think he's definitely aware of the committee in general, but just to sort of put that out there. I guess that's another type of stakeholder engagement.
Absolutely. Great. Anyone on the call feel like they're not yet at the stakeholder engagement, they haven't quite made it to stakeholder engagement yet, or anyone on the call feel like they are beyond the stakeholder? You always engage your stakeholders, but as far as engaging stakeholders to inform the policy development, does anybody want to speak about if they feel like they've already worked on that piece or started that piece, and want to give some guidance to the folks that are in that process as to what they've learned and the challenges and successes that they've had?
So this is Brittany from Century. So what we've done, what we've been working with our liaison at Century in regards to staff wellness, is finding opportunities for staff to exercise and engage in wellness activities during the actual school day. So the time that we compromised on, since prep time was out and class time was out, was during their lunch. And so now that we have this policy the policy established within the administrative level, what we're encountering now is that we're finding that on a cultural level, so staff doesn't feel necessarily comfortable, or they feel like they're going to get in trouble for using their lunchtime for wellness activities. So now that we've got the policy in place, we're finding out that even though it is acceptable at the administrative level, culturally the staff still doesn't view it as being acceptable for them. So we're trying to, with our wellness committee and I, are trying to find ways to kind of remove that social barrier so that staff feels like they can engage in wellness activities during the school day, during their lunchtime.
That is a fantastic example, and that shows us where again, this is an iterative process. It all happens not in a linear fashion, but now we're moving towards that piece of planning for implementation. You've hit some barriers that you didn't anticipate because you engaged your stakeholders. So that piece, communication, is going to come in. That's going to be huge. Risk management, which you've already started to address by trying to alleviate the concerns that people have, the fear around what they're going to lose. And then you'll be able to go back and plan for monitoring and reviewing whether or not this works as you plan for your implementation. Does that make sense?
Yeah, no, that makes perfect sense. Yeah.
I think the risk management piece, it sounds like, also kind of includes here, finding a time that was not taking away from your staff's obligations, and considering the other stakeholders who are part of it. Schools don't want staff planning time as staff planning time, but being able to think about wellness as a whole without conflicting with their priorities. So as Tara Ann said, it is kind of an iterative process, and each of these triangles does depend on one another.
And you were able to find the resources, you were able to garner the support of your governance. That's really a great example. So what would be helpful, do you feel, to, let's go ahead and work with this for a few more minutes, and then I'd like to go back to some of the sites that maybe aren't even at the policy development level yet, but I'd like to continue with your example. What do you feel is your next hurdle? What do you feel is going to be your next barrier, and how can the other sites support you, and how can we at the School-Based Health Alliance support you?
Well, I'm not certain about globally as a network how I can be supported, but through the Wellness Committee, we've developed a timeline for gathering administrative support and showing their support. Be taking place during lunch, and kind of explaining it, and again showing how it's not only encouraged, but that it really has positive effects for anyone that plans on participating in it, and that it's just really everyone's all aboard, every level, every department. Everyone is definitely supportive of the program and seeing it implemented in the school, and then just implementing the program with those. Kind of knowing that those barriers are in place and kind of just repeating that process. Knowing we'll probably have to say it a bunch of times before it really takes root, just because that's kind of how development works. So that's our plan as of right now.
I think that sounds fantastic. And it sounds to me like you've identified some champions and some teacher champions. Do you happen to have any youth champions or administrative champions that are in your group?
Yes, we do. Our school liaison, who's the assistant, one of 3 assistant principals, is definitely one of our champions for us. We don't have youth champions for the staff program. We do have a student youth program that operates within the school, but they're operating on separate issues, more adolescent-geared issues. In the school.
I really have a great coordinator.
This is Tara from Century. I work with Brittany. Hi, Brittany.
Hey, Tara.
Hi. Janelle, our champion, I think when her and I have talked casually, we've talked about her being an example to the staff, but also identifying some of the other staff that we can use. And not guinea pigs, but to get them using the policy at this time so that more of the staff will see them, visualize with that, and then they will feel more accepted to be able to do it. So those staff that may have been seen as like off the peer group per se in that hierarchy, trying to use that social capital within that system to help us step forward.
Sorry, I had a little bit of a hard time hearing the very last part of that.
Can you plug this in?
So using the social capital of those maybe more prominent staff in the school and trying to get them to be our champions, the other newer staff, United Speaking staff, would be more accepting of this policy using it at that time.
Great. So it sounds to me like you've got the policy, it's fine, you've identified your champions, and now you're in that communication phase and we're trying to get implementation consistent across different groups, if I'm hearing you correctly.
Yeah.
Great. Okay. Well, that's another good point to bring up, is that consistent implementation. One thing to think through when we talk about this box of planning for implementation, we have different audiences. We have different, and that goes back to how different people are going to look at this, how different people are going to define or interpret your policy. So I like that. That's a great example.
There was a suggestion from Mandy that there's something that I can do as a program manager to just make sure that I'm sharing out sort of the overall Hallways to Health programmatic objectives and sort of direction with your sites so that you can have something that's uniform to share with your stakeholders. It's something I'm definitely happy to create and share with you. And then Brittany, I just want to ask you, because it sounds like you've really found a way to do stakeholder management with regard to staff wellness, and the fact that Janelle is involved at a school level, and that she's writing, I know that she mentioned she's going to write her responsibilities with regard to the school-based health center sort of up in preparation for if she is to transition for someone to come in and fill that role. It would be great for you to be able to share out with the group over Basecamp how you have engaged your stakeholders.
Oh, sorry, I was muted. Yeah, no, that I would be happy to do so. Is just make a conversation and enter that in?
Yeah, I think that would be great, especially,
Okay.
You know, you talked about some of the ways in which you engage your stakeholders and the data which you're collecting. I think it would be great to share that out, and if anyone has additional questions, they can move forward with that.
Hi,
Go ahead, please.
Hi, this is Pat. I just wanted to let you know that I have joined the meeting, but I didn't want to interrupt.
Thanks, Pat. Hope everything went well.
Great, thank you.
Actually,
I'd like to ask one of the sites to speak up that's way in front of, meaning not yet engaging stakeholders. Having heard from the folks that have engaged some stakeholders that are starting to do implementation, and going back to that feeling of I haven't looked at this yet, which is absolutely okay. I'm not quite sure what to do with this. How are you feeling, and what needs to happen, or what do you feel like your next steps are to get to the point where you are engaging stakeholders, or getting to the point where you are developing policy based on all of the work that you've done so far?
This is Kay Sofer from Northwood. I've been on, but listening. You know, it's funny. I mean, we're not, I guess this isn't meant to be in order, so I'm reading from left to right as I've been trained to do. And we've been better at developing resources.
Right now.
Huh?
I'm just kidding. This is Kara Ann, and I'm telling you that, again, I shared my story. This is very, very difficult work, and I want to acknowledge that. And I hear you when you say it's hard not to read from left to right, so I'm glad you put that out there, because we're here to help you reframe that thinking. I didn't mean to interrupt. I was trying to be
That's okay, because we've been much better at developing resources than stakeholder management, looking at this. And so we've been fairly good at developing sources of healthy eating in the school and healthy food. And every time we step out into stakeholder management, something blows up. So, I mean, it has taken literally years to get the administration to buy in. We had a new principal a half of a year into the grant, and she really was not interested. And she had a vice principal who was sort of near retirement as the liaison to the school wellness center. And she came once and said she was, the principal came once and said she was interested in substance abuse, and we developed this whole program, and then she showed no interest in the program. And this year we got a meeting with the principal basically because I used being a child of the 60s, I used a technique from the 60s, which in a very personal way, which was a sit-in. I sat in her office until I got an appointment. And then a whole bunch of people came to the appointment, and then she said she was very concerned about absenteeism. So we tried to mesh the goals of the program with absenteeism. And what we proposed was a breakfast in the classroom program. We have a 19.9% absentee rate in this school. It's a high school, so almost 20%, I mean, for all intents and purposes. So we got a group, Nourish Now in Montgomery County, to donate breakfast food, and they did, but oh, this was a wonderful success. We finally got her to appoint one of the new sort of go-getter vice principals as a liaison to the school wellness center, which was a wonderful success. And we had a meeting with her, and she said, well, I'm not really comfortable putting in the classrooms yet. How about in the counseling office? And I thought, okay, it's a first step. And then she said, well, I'm not really comfortable with that. But we had already developed the resource, so I wasn't comfortable telling them no. So we brought the food in, and then I was going to give it out early in the morning in the health room, and the nurse said, no, we're not going to do that. That's too much work. So we started out giving it out in the wellness center and after school activities. Again, it was healthy food, and one of the kids in the wellness center had a very, very mild allergic reaction, basically itching in the throat, and everybody had a heart attack. So all of a sudden, you know, like a lot of the stakeholders are really like freaking out. You know, I don't want anything to do with this project. Everybody's going to die. And of course, in the vending machines in the hall, they're selling both peanut M&Ms and Snickers, which have peanuts in them, which are a big allergen, which I think is hysterical. So we're having this like one step forward, two steps back thing. We're going to have another meeting next week. One thing which has been wonderful in terms of stakeholder management, we do have one of the administrative nurses really in our corner and on board. So that's been really, really helpful. But there is this little bit of, oh no, this is some isolated little project that doesn't involve the whole school. And that's not my project. I don't want to do anything. I don't want to lift a finger. I don't want to have a bowl of apples in my health room, or my, you know, that's too much work for me to allow kids to pick up an apple from a bowl, even though it's healthy. Let them get candy bars from the vending machine. So we have a lot of that. At the same time, we've been very successful at reaching out to community resources who are willing to donate or for very low amounts of money give healthy food to the school. And, you know, I'd like to develop that because we do have a lot of food insufficiency in this school. You know, ideally to the point where we could even have like a small branch of a food pantry here. But we have to pull back on that because we can't keep developing the resources in advance of having the people in the school on board. And so that's sort of been our you know, push me, pull you kind of situation. And that's, we've moved ahead from where we were to start, but that's been kind of the problem all along here.
Well, it sounds to me from what, if I'm reflecting back correctly, I'm very, very impressed with all the challenges that you've had. It sounds to me like you found some community champions. I'd be curious to know who in your school. It sounds like you found the vice principal to be somewhat of a champion there, and it sounds like you've got the resources and you've done an excellent use of data to look at the absenteeism and to connect that back to what you're focused on. You've really utilized your resources well. You've engaged your stakeholders. You've looked at risk management. You've really hit a lot of the triangles here that we talk about when we talk about policy development. And it sounds like you have your champions, maybe not fully on board, but there may be some other within the school. So I'm very impressed with what you've done given the challenges that you have.
Yeah, I guess, I mean, you know, maybe I'm someone who, you know, expects the world. I really like this vice principal. I really like her. She's just a little tentative, and I'm not sure if that's her being tentative or she, you know, she's of course worried about the people above her. You know, I have to say the nurse administrator we have on board is not tentative at all. She's very gung-ho, and that's made a big difference, I think, both in what we've been able to do and honestly psychologically. You know, just for me, you know, that I'm not feeling like I'm dangling in the wind here.
I would love to see this on Basecamp. I would love to see some conversation on Basecamp around what the other sites have done to engage stakeholders or to utilize the nurse more fully, because you do have some champions. And I hate to cut off this conversation because it's very, very rich and very exciting for me, but I want to be respectful of Jordana's time and your time and the fact that we have a few more minutes to wrap things up. But do you have some?
No, it's just, you know, it's interesting to think about, okay, so a lot of the sites have indicated, okay, we haven't started thinking about these steps to policy framework development. We haven't even clearly articulated what our policies are going to be, either because we're still working on looking at needs assessment data or because we are constantly in conversation with our stakeholders about what we're trying to achieve, or we're still trying to get around the shift from thinking about programs to what is our larger story and kind of end result about policy change school-wide. But it sounds like many of these components, as many of you have shared, have been articulated, even if you haven't conceptually realized, oh, I'm negotiating a contract, I'm planning for implementation, I'm thinking about my governance, I'm thinking about resources, not only resources that I'm creating to be able to do health education and do physical activity and do staff wellness, but resources really to be able to uphold and enforce said policy. So for instance, Kate, for you, that might be an area that you're looking to grow. So you have secured some of the resources to get a breakfast program, but you need the personnel and manpower resources, not only the stakeholders to approve of the process, but the people to be able to actually hand out the food or get the food from the nonprofit and the community-based organization, and then donate it at the end of the day. So again, these are triangles to come back to, and it's not a starting place. So even for those of you who said, you know, we haven't started to think about these triangles because we're just getting our data, you really have been, because you've been doing this work for the past 2 years with regard to planning. And now we're just coming back to kind of revisit and hone it. So I do want to make sure that you know that you really are doing this wonderful work. So moving forward in the presentation, there was another slide. There's a slide right after this, which is giving me some trouble in not letting me advance it. Not sure why. I apologize. Okay, here we go. Okay, so where it was kind of a checklist, which we assigned before this call, not to be able to, you know, provide a written feedback to us, but for you to check in with yourself and with your team and with your stakeholders. Can I answer what is the policy I'm working towards? What is the governance? And where did I get stuck? And why did I get stuck? Or what additional assistance can I use from my stakeholders, from my team, from the School-Based Health Alliance, from my state affiliate? Where can I map out that which triangle am I going to work on, as Aurora kind of indicated. So if risk management is something that you know that you need to think about when developing a policy and you haven't yet started to think about it, maybe that's the next piece you take on. Or maybe when you're thinking about a breakfast program or a school-wide physical activity program like GoNoodle, you would look at acquiring the resources first. So acquiring the software, making sure that it's you know, within your tech, or acquiring the food, etc. So this is just a checklist for you to help you think about where you're moving next. So again, not anything that we have to turn in, but something that you know, is to be used for a tool for you. So we have some examples here of school-wide policies that you spoke about. Kay spoke about breakfast programs. Many of you have breakfast programs. You have first breakfast programs. You have breakfast after the bell programs. This particular program there's a logo in the upper right-hand corner. It says Breakfast in the Classroom is a program for specific states. So you should look into that if you don't have one. And I know Hungry Harvest, Mizan, your school does Hungry Harvest, correct? Oh, I think, hello? Yes. So I think Hungry Harvest is a program that delivers fresh and seasonal produce to students and families in need. Another policy that some of our sites are working on is restorative justice. So bringing in mindfulness, conflict mediation, etc., not only into the classrooms but into the school. So Mizan, do you want to speak a little bit about restorative justice in your school? Oh, okay. Mizan is no longer on the call, but Mizan School has restorative justice all throughout the school, and has a restorative justice coordinator who's working on social emotional health for all the students. GoNoodle, which we mentioned at the beginning of the call, is a school-wide physical activity, an opportunity for school-wide physical activity. And Gabby, if you want to talk about restorative justice, you can go ahead. Hello, can you hear me? You're a little quiet, so if you could turn up the mic. Oh. Can you hear me now? Yeah. Oh, great. Okay. Sorry about that. Yeah, so for the past few years, Roosevelt has had culturally based and gender-based healing circles. So that's
where we take the kids into the clinic, and they do, it's about 8 weeks of restorative justice. But restorative justice has been so kind of popular throughout OUSD, and particularly at Roosevelt, they've actually spread it to also the different classrooms. So that's where we have the restorative justice coordinator who actually goes into some of the classrooms to reach out to other students. So the ones that come to the clinic have usually been identified by the COF team or by teachers who would really benefit from this additional assistance. So here is going on at the same time, which is great.
Thank you so much. Yeah, that's a great description. So lots of different types of policies, and that, you know, are in all of our 3 areas. And, you know, as we move forward on this work, we just encourage you to really think about all the work that you're doing in this population sphere, and what you're doing in the clinic that cascades into the policy, into the system change and policy work, what you're doing with the small groups that cascades into it, and there may be different approaches, as we said. So just want to help you hone that story. And I just wanted to share with you, we have some resources on the School-Based Health Alliance website under our section called the Blueprint. So if you click under resources, then you click under Blueprint. These are 3 resources which talk about creating school health policies, and refer to some federal policies and timelines for creating and rolling out policies that you can use in tandem with the policy development framework that we've been talking about. I will note that the Developing Wellness and Nutrition Policies document is a little bit old. It's from 2004, but it still has some good ideas that are applicable and not tied to the specific act that it's talking about, but in creating school-wide wellness and nutrition policies. So definitely take a look at these resources, because they provide how-to guides as well as tips and timelines for creating policies, engaging stakeholders, managing resources, and whatnot. And then I just wanted to shift gears and just move to talking about project updates. But before I do that, does anyone else have anything to weigh in about this policy development framework?
Yeah, I actually have a question. This is Aurora from San Fernando. I'm not sure if this is quite off topic, but like I mentioned, we got all our report from our data today. And as I'm looking at the data, I was wondering if you had any tools or resources available to demonstrate whether or not the certain results are statistically significant. And so we have certain questions that answer yes, but it's 10% said yes, but is that statistically significant? Is that something that we should address? Should we not address it? And so on and so forth, if that quite makes sense.
Yeah, I think that's a great question. First of all, I think that's a question which you should involve your team and your stakeholders on your end to identify, what your top priorities are, and whether there's a sense of whether that's a discrepancy from something that happened in the past, or this is just the first time it's being documented as opposed to anecdotally. And then the other thing I would say is to connect to Kara Ann here at the School-Based Health Alliance, who can help you look at that data in addition to the county level data, and look on our mapping tool and see whether that is, whether a 10% food insecurity rating is something that's high for your area, or high for high schoolers, or how it relates to other data that we have. So I will connect you. You can connect with me, and we can connect you to Kara Ann. But I think it's definitely a good question, because, and I think this is one that Sarah Turbot had as well, is that when the sites that are doing the RAPS needs assessment, the output of the data is just in percentages. So you're not really sure what's the root cause of that percentage. And I think APHA sort of encouraged you as well to do follow-up discussions with your youth to understand, okay, what is the contributing factor to this yes answer? Is it because this is something that is a real concern, or is it tied to something else? Is it tied to a concern about safety and neighborhood, where really you could, where that criteria might help you strategize about what policies will help you change housing, will help you change food, will help you change bullying if you're focusing on an upstream factor. I think it's a whole sort of data picture, if that helps.
Yeah, thank you. So I'll be in touch with you to get Kara Ann's information.
Sure thing.
And I'm on the website under staff. You can reach me as soon as you need to, and I'd be happy to help you.
Thank you.
Great question. I mean, I think one that many of you have, as you're going through your environmental scans and through your needs assessment results, are struggling with, because you are often only 3 or 4 people in a school-based health center, and there's many issues your school is working on, and that is what we are trying to get you to do through Hallways to Health, is kind of pick one priority area that's around food and activity, and one priority area that's around social emotional health, and one priority area that's around staff wellness that you want to focus on, and you want to create policy and system change and all of your work around, as opposed to saying, let's change the entire scape of poverty for your whole school and for the whole world. While ambitious and lovely, and I applaud your efforts if you're able to do that, I think it's not feasible or realistic. So just moving forward to some quick project updates and shifting gears a little bit. Thank you so much for this really wonderful and engaging call. It sounds like we had a lot of participation and a lot of really thoughtful reactions. So really, really thank you for that. Our next call will occur on the 5th, same time, same place, 3 to 4:30 Eastern Time, and we will let you know what the focus of that call will be in the weeks leading up to that call. And the convention, the School-Based Health Alliance Annual Convention and Midpoint Meeting will be held in Arlington, Virginia. So you're coming our way from June 26th to June 29th, and the Hallways meeting will be an exciting opportunity to share out what you have achieved over the course of the year and to get some additional training on some sustainability elements on Sunday, June 26th. So please be sure to send in your registration for our meeting, as well as check the box if you're attending the motivational interviewing training, and if you will be staying for the whole convention as well. And please book your travel as soon as you can, and send along any travel reimbursements as well. And just a reminder, we sent you $3,400 at the beginning of the year, which can be used as additional costs, as an additional sort of cushion to help facilitate your travel costs. The third quarterly report will be due April 15th, unless otherwise noted. And we really want you to share the school data which you have collected over the course of the year, whether it be attendance, discipline, general clinic data, your RAPS data, and anything else that helps to share your impact and tell your story. And we'll be scheduling follow-up calls from the site visits and sending along resources to each of the sites specifically. And many of you in the site visits had a real desire to hear and learn from each other to get ideas. So again, thank you for engaging on this call in that manner. I think that some of us are auditory learners and some of us are visual learners, so be sure to post some of those resources and tools on Basecamp and stories as well. Put your questions up there, ask each other, as well as your best practices. And we will be scheduling regional meetings in the fall. Hopefully your state affiliates have given you the dates for those meetings, and we'll be looking forward to having another in-person opportunity to interact and to do some training and follow-up. That's all from me. And that's all for me. So does anyone have any questions?
Yeah, this is Gabriella with Roosevelt, and I was just like looking at the third quarter report and talking to Mizan, and I was just a little confused on some of the instructions. It sounds like there's going to be like a technical meeting after the report's due, but a lot of the questions are asking, like if instructed, updated staff action plan based on site visit comments. I don't think we've received any of the comments yet, so I'm just wondering how we address that in the report, or maybe they're posted on Basecamp.
I'll be following up with each site individually if I need you to submit kind of like a modified action plan, okay?
Okay, so if we haven't heard anything, like we can proceed to fill it out and then,
yeah.
Okay. And then, actually, sorry, one more question. This is a budgetary question. So for this year, it was, 40,000, and then next year's 30,000. But, it looks like we might have some extra funds. So can we roll over any extra for next year when we anticipate we're going to have more personnel, or is there a formal process that we have to do, like a letter for the budget?
Great question. I don't know if I should be answering this online or offline.
Oh.
But essentially, as we're the grantor, we have provided those funds in the assumption that you're going to use them this year. But we're not asking for budget reports from you guys.
Okay. Okay.
Therefore, yeah.
Okay.
You can connect with me over email if you have follow-up questions to that.
Sounds great. Okay. Thank you.
Great. Anyone else? Okay, great. Thank you all so much, and have a wonderful weekend. And please be in touch if you have any other questions about convention, about the quarterly report, and if you're starting to think about filling out if you're starting to think about editing your action plan, or you're developing your policy framework, and you just want our feedback, that's what we're here for. So thank you so much.
Jordana, can you send all those dates out in an email, because that's easier to put into our calendars? I know you have, but if there are any you didn't already.
Is that for the dates for the calls or for the convention?
So anything that you didn't already send out in an email, because not on my email now, I'm looking at your post, so I have to switch it into a calendar. That's all.
Sure, I'll send the dates for the calls and for the convention in email as well as in the calendar.
Okay, thank you.
Thank you.
Bye-bye.
Okay.
Bye.